Hey, it's April 7th, and here's your daily coronavirus news roundup. Today, Prime Minister Justin Trudeau announced that 30,000 ventilators will be made in Canada for COVID-19 patients.
We're working with Thornhill Medical, CAE, Ventilators for Canadians, and a group led by Starfish Medical to produce up to 30,000 made-in-Canada ventilators.
Trudeau didn't say exactly when the ventilators would be available to hospitals, but it could be in the coming weeks. Also today, the state of New York recorded 731 new coronavirus deaths, their highest one-day total so far.
Behind every one of those numbers is an individual, is a family, is a mother, is a father, is a sister, is a brother.
But things might be looking up. Governor Andrew Cuomo said that the average number of people admitted to hospitals each day for COVID-19 has been dropping over the past 3 days. The total number of hospitalizations in New York, which has been under strict lockdown, went from 1,294 on April 2nd to 676 on April 5th. And lastly, Japan, which now has around 3,900 confirmed COVID-19 cases, has officially declared a state of emergency. Today, Japanese leader Shinzo Abe announced a month of new restrictions and unveiled a new financial stimulus package. Okay, now on to today's episode. So over the last few months, you've probably been hearing a lot of vague references to the Spanish flu, how it's the deadliest flu in history, the one that should have scared us into preparing for this new coronavirus. And if you're like me, you might not have known much about it beyond that. But there are a lot of reasons why epidemiologists and historians keep bringing it up. And the more you read into it, the more obvious and frustrating the parallels seem. So today, we're going to dedicate our episode to looking back at the 1918 influenza pandemic and what it can still teach us about today. My guest is John Barry, the author of The Great Influenza, the epic story of the deadliest plague in history. I'm Tamara Kendacker, and you're listening to Wait, There's More. Hi, John. How's it going?
So far, so good.
Thanks so much for doing this. I really appreciate it. John, I've been doing a lot of reading about the Spanish flu, and it's one of the most shocking and awful things I've ever read about. And I remember hearing growing up that the Spanish flu killed more people than World War I, but for some reason I didn't process how bad that was. You probably talk about this all the time, so I wonder, is that common? Why do you think so many of us have no concept of how deadly and brutal this flu was?
Well, I think until a few decades ago, historians tended to write about what people did to people and not what nature did to people. That's number one. Number two, at least in the West, where the press was censored or self-censored, they actually wrote very, very little about it. In some cities in the middle of the pandemic, you literally couldn't find a story about it. They wouldn't even list the dead. That was because of the war effort. They didn't want to hurt morale. So that distinctive newspaper record, it doesn't exist. That normally covers things when historians look at stuff. That and it was pretty brief. I believe the coronavirus is unfortunately going to last a lot longer than influenza did in 1918.
So why don't we start with the basics for people who don't know anything about this? What was the Spanish flu?
A respiratory virus jumped from animals to people, infected about a third of the world's population, killed between 50 and 100 million, which adjusting for population would be between 220 and 440 million people today. But it was not spread out demographically. Probably 2/3 of the dead were actually otherwise healthy young adults, generally aged 18 to 45 or so. The peak age for death in 1918 was 28. So in that narrower population, in a very short span of time, generally about 14 or 15 weeks around the world, a very significant proportion of the entire population of people in that age group died.
Wow. And I understand that the name Spanish flu is a bit misleading because it didn't actually originate in Spain, right?
Correct. There are theories about where it did originate. None of them include Spain. It was well established elsewhere in the world. But Spain wasn't at war, didn't censor its press. The king of Spain got sick. Spanish newspapers were writing about it, and it acquired the name Spanish flu.
And what were the symptoms of the Spanish flu?
Well, the overwhelming majority had what we all know as a normal influenza attack and the same symptoms, but a minority, the symptoms could be horrific. It was initially misdiagnosed as dengue, typhoid, cholera, all producing symptoms not normally associated with influenza. But probably the two most frightening symptoms, particularly to a layperson, would be people could bleed not only from their nose and mouth, and nosebleeds were actually pretty common, maybe 10 or 15% of cases, but you could bleed from your eyes and ears. Pretty terrifying. People could turn so dark blue from lack of oxygen. In the book, I quote one doctor writing a colleague. He had difficulty distinguishing African-American soldiers from white soldiers because their pallor was so similar. That, of course, spread rumors of the Black Death.
Wow.
My mother and father and my two sisters all had the flu. It was a very sad period. There was like a sadness over the city. I remember them telling me that a young neighbor, they saw him coming home. They watched from the window, he coming from work. And the next afternoon, they saw him carried out. He died.
And had the world ever experienced anything like this before? Did they even know what a virus was at that time?
In the developed world, they had experienced influenza, including a pandemic in 1889, 1892. In the less developed world, where there had been less interaction, they had perhaps never seen any influenza viruses. That's why the death toll has this wide range of 50 to 100 million. We don't have good numbers from the less developed world. And if you had never seen any influenza virus, you were especially vulnerable. For example, one place where we have very good numbers, an island in the middle of the Pacific, Western Samoa, 22% of the entire population died in just a few weeks. Another Pacific island, 14% of the population died in 16 days. So those people who had no natural protection of any kind against influenza, again, died in high numbers. At the time, they didn't know if a virus was an entirely different organism or whether it was just a really, really small bacteria. They referred to all pathogens actually as viruses, and they distinguished what they called filterable viruses, something really small that could pass through the smallest filter. I think a lot of scientific breakthroughs that developed out of the pandemic, but they took time, and the pandemic moved very rapidly. So those findings didn't arrive in time to help. And of course, many of them wouldn't have helped anyway. We still have difficulty making vaccines against influenza because the virus mutates so rapidly. We still don't have any really good drugs to take against influenza.
So if they didn't know what it was at the time, there was no cure for it, how were they treating it? I read that some doctors were prescribing crazy amounts of aspirin, for example.
Pretty much anything that someone reasoned logically might work was applied. They tried vaccines, but they were designed against the wrong pathogen, so they were not very effective. The treatment was really just supportive care, which is right now all we have for coronavirus, except it was supportive care without the kind of modern intensive care unit that are available today if the healthcare system is not overloaded.
And what was happening in the world at that time? I've just been a bit confused about this timeline, and I was hoping you could clarify. I know World War I ended in November 2018, but the pandemic started in 2018 and it lasted for 2 years. And from what I understand, the war is kind of what helped the disease spread around the world. Can you just explain that overlap?
Well, actually, I don't think the war had a major impact on the spread of the disease. It may have accelerated a couple of weeks, but it would have happened anyway. In the 1600s, influenza pandemic managed to make it from Europe to North America, where it took a very hard hit in Virginia and Massachusetts, and even harder hit among Native Americans. So you don't need airplanes, you don't need a war to spread a pandemic.
It was almost the end of World War I, and Canadians started to hear about the Spanish flu spreading across Europe.
It's really a lot like today, we kind of watched it coming, and it really starts out like somebody else's problem. By August, there's the big news is that it's kind of ripping through American military bases.
Troops moving from the United States did take it to Europe in larger numbers, so it got a little bit faster start, but again, it would have happened anyway. Since it was a virus that other influenza viruses gave you some cross protection compared to if you had never seen any influenza virus before. But it was a new virus, and therefore, it just spread. That's what influenza does normally. And there was a spring wave in 1918, which was very mild and very hit or miss. Probably missed more places than it hit. It seemed to subside, probably because the weather got warmer, but it didn't disappear. You might say the second wave started in Switzerland, where there was an outbreak so lethal in late July that military intelligence report said that it's being called influenza, but it's actually the Black Death of the Middle Ages. Of course, it was influenza, not the Black Death. And by late September, that second wave hit pretty much worldwide almost simultaneously. Probably 2/3 of the deaths occurred in 14 or 15 weeks from late September through December. It was a third wave in the spring of 1919, and after that, it sort of petered out.
And what were different governments and public health officials doing at the time to try and contain it? Were they urging social distancing and locking down the way that we are right now?
Largely. In most cities, schools, theaters, bars, and so forth were closed.
90% of the deaths that happened here in Toronto happened in October of 1918, and about 1,800 people died. That is about 25,000 people today in today's numbers. And once those rates of death started to climb, the Department of Health here in Toronto decided to shut all the theaters. This was also at a time there was no social media whatsoever. There was no radio even by then. Radio didn't come into a few years, after 1923. So back then, the only way to really get this information out was through newspapers.
Not every city did that, but almost all of them. And the ones that did it early, before a lot of people were dying in the community, that seemed to have significant impact, at least on flattening the curve.
Notice is hereby given that after Saturday, October 19th, 1918, all theaters, moving picture shows, and other places of amusement, including pool rooms, billiard rooms, and bowling alleys throughout the city, shall be closed during the period of the influenza epidemic.
This enormous surge of cases, there was still a huge surge, but it wasn't completely overwhelming. But the cities that did it later, that waited until there were a lot of deaths in the community, they suffered much more grievously. And the reason, of course, the virus is already widespread in the community. People get tired of staying home and being isolated. It's difficult to get long-term sustained compliance. So there was always pressure from businesses to reopen. And in many cities, they reopened a little bit too soon. And there was a resurgence. In many cities, they went through a second series of closing orders, again, with a lot of resistance from local business communities. So there was a lot of politics involved. I think in the coronavirus, there will be a resurgence whenever we open things back up. But I think that's unavoidable. We can't keep the economy completely shut down. There are ways that resurgence can be minimized, but it involves widespread testing, which, at least in the United States, is still not available. It's an incredible debacle. And, rapid tests for antibodies and so forth will be available. I'm not sure exactly when, but those things will be key to a rational restarting of the economy. There's no indication, unfortunately, that we really have a plan yet for doing that.
We'll be right back. We've talked a bit about the numbers of people who died during the Spanish flu, but I'm wondering if you could kind of put them into context for us. Like, who was the flu killing, and what kind of impact did this disease have on families, on communities?
Well, unlike coronavirus, the target for the 1918 virus was otherwise healthy young people. It was a very different target population. And in fact, in the West, where people had seen other influenza viruses, the case mortality overall was about 2%, but that's almost meaningless because it was so bunched into the younger people. According to Metropolitan Life, 3.25% of the entire population of factory workers, not case fatalities, total population of factory workers in that age group died. So, and we're talking about in a period of weeks, because influenza would pass through a particular community in anywhere from 6 to 10 weeks usually. So imagine that you're an industrial worker and you're young and you think you're healthy, and all of a sudden, all around you, your colleagues, your age, your friends are dropping dead. The result of this was incredible amounts of absenteeism at work in the 60-70% range, most likely, and significant economic impact and personal impacts. Incredible tragedies. When I told my aunt that I was working on this book, she told me that it was the only time she ever saw her father cry. And that was because a couple across the street died and left several orphans. There were a tremendous number of orphans. In fact, it led to the establishment of child welfare organizations all over the United States. There were so-called orphan trains in some states where a train would show up with orphans and people would go to the depot and adopt them. A lot of those kids ended up being abused or exploited in some way, which added another tale to the horror.
I also read that there would be priests that would drive horse-drawn wagons down the streets and they'd pick up bodies that people would leave in front of their homes, just like they did during the plague.
That certainly happened in Philadelphia, that priests were actually driving horse-drawn carts down the street, asking people to bring out their dead. Probably every place in the country, certainly almost every place in the country, ran out of coffins. Coffins were actually being reused. Most places banned public funerals, but the immediate family might be there. They have the service, bury the body, without the coffin, put another body in it, in the coffin. In some cities, they were actually digging mass graves with bulldozers.
In 1918, my mother was like just 11 years old, but she remembers the church bell would ring every day. There's a certain bell, a notice for the death. And she said she remembers as a little girl how awful it sounded.
You wrote in a New York Times column last month that leaders in the time of pandemics need to tell the truth, no matter how hard it is for people to hear, that's the biggest lesson that we can learn from the Spanish flu pandemic. Why did leaders being honest with the public prove to be so important in the context of that pandemic?
Well, because we were at war, an entire propaganda machine had been created, which was designed to keep morale up. But that meant to the people who ran that propaganda machine, they would never say anything negative. And when the pandemic came around, the response of national public health leaders was to say things like, this is ordinary influenza by another name. As you know, it was the Spanish flu. There was no Tony Fauci back then. And this line was echoed by local public health leaders almost always around the country. The result was people couldn't trust what they were being told. They knew this was not ordinary influenza by another name. And without anyone to believe, without anyone to trust, they were left to their own devices, knowing nothing. And I think the imagination is much more powerful than reality. If you watch a horror movie, it's always scarier before the monster actually appears on the scene, when your imagination is taking hold. And the result was considerably more panic and chaos than we are seeing today. I mean, now the only thing that counts as chaos is people buying toilet paper. Then there was real fear in the streets in many cities. There were reports that people were starving to death because no one had the courage to bring them food. So they were dying not actually of the disease, but of starvation. Nothing like that is happening today. But that's what happens when you don't tell the truth. In addition, if you expect people to follow your advice, they have to believe you and believe what you're saying. So when you call for social distancing, it's not going to be successful unless people are going to comply with the advice. And if you don't tell them the truth, once you lose your credibility, they're not going to pay any attention to you. So that compliance, which is so important to controlling the spread of this disease, is dependent on people believing what they're being told.
Yeah. And I can definitely think of examples in the current context of leaders not really being forthcoming about what's happening with COVID-19, like Donald Trump insisting for weeks, for example, that the U.S. had the situation under control.
We're going down, not up. We have it so well under control. I mean, we really have done a very good job.
I wondered, are you seeing that playing out right now?
Well, obviously at this point, Trump has recognized that it's real. And I guess it's about 3 weeks now that he said we were at war. That was his first statement taking it seriously. By the same token, the compliance issue I mentioned earlier, after saying for almost 2 months that this wasn't as bad as in regular, ordinary seasonal influenza.
It's a little like the regular flu that we have flu shots for. And we'll essentially have a flu shot for this in a fairly quick manner.
And otherwise minimizing it. You got people who are his followers thinking that. So when you ask them to conform to social distancing, it makes it that much harder to get them to do so.
If I get corona, I get corona. At the end of the day, I'm not going to let it stop me from partying.
The one thing that stayed with me, which you just touched on, was how the Spanish flu created these divisions between people. People started to trust each other less. It destroyed intimacy for a period of time. Like, people were afraid to be around each other. Do you think the same thing could happen here? And is there a way to prevent that?
Well, yes and no. If you social distance properly, because you're concerned about being around other people. But we go for walks, my wife and I, and when we see other people, even though we're already apart, and yet we move further apart as we pass them on the sidewalk, there's almost a camaraderie in that. And we're sort of laughing at the distancing, even while we're doing it. It's different. I think there's a sense that we are all in this together. We are all in this together. In most disasters, communities come together, and the best of humanity routinely shows itself. That did not happen in 1918, largely, in my view, because trust disintegrated. But anecdotally around here, it seems to me that is happening. But I sort of have a feeling, just walking down the street, that the community is trying to rally and help each other, which is what you hope happens and what normally happens in disasters.
John, thank you so much. Really appreciate it.
Okay, you're welcome. Take care.
All right, that's the show. Thanks so much for listening. If you have any questions about the coronavirus or have ideas for topics you want to hear us cover, text me. Seriously, I'm at 437-235-2849. I'm Tamara Kendacker, and I'll talk to you tomorrow.